Hello and welcome to Business Continuity Planning for the year 2025-2026. We state the year just because things may change going forward. This is an extended version of any previous business continuity planning you may have attended with me, because we have added in some extra parts connected with dynamic lockdown. And this was in response to problems that have happened within the Manchester area, where there has been the need to have a dynamic lockdown of a couple of surgeries, and the understanding that perhaps this wasn't something we were very used to doing. So we thought we'd add in some extra training just in case you find yourself in this position going forward. In case you haven't been on any of my training, and to give you a few details about me, I am called Luann Stewart and I have been a practice manager over several areas over the years. I have currently just recently retired, but still here helping you with your training and mentoring at this stage. And on that, I am a trainer and a mentor for the Lancashire Training Hub, for the LMC in Preston and Cumbria, and a trainer and mentor for you, of course, today under Manchester GP Excellence. I also privately consult in estates and finance, and I do a bit of locum practice management, so quite busy. But I'd like to take this chance because I think it's really important to go over your business continuity planning and making sure you have everything in place. And on top of that planning that we need to have in place, as we said, there's some dynamic lockdown procedures that we really do need to go over. So what we're going to go over today in today's discussions is setting up your plan, letting you know about the templates that will be made available to you, and those are held by GP Excellence. They are up to date as of the current time, which is 2025-26. But obviously after that date, you need to really just check and just see if there's been any more further updates under the Terrorism Act or under Martin's Law or any other areas where things may have changed, and just update your plan. Doesn't mean you'll need a whole new plan. Your plan is in a good state if you follow this template, but you may have to add new rules and regulations in at future dates. Well, this is the point where when I have a live audience, I normally ask, why do you think you need a plan? Let's just give that a moment and have a think. Maybe write down a couple of ideas. Great, let's hope you've got some ideas in front of you. Well, we need a plan because as much as we like to assume everything's going to go well, we really need to hope for the best, but really prepare for the worst. And that's making sure we have a plan in place for anything that might go wrong. When we have those plans in place, it's much easier to work going forward because we can grab that plan if something goes wrong, and we don't have to spend that extra time thinking, what should I do? Because it's all planned out there for you. We should also have dynamic lockdown plans, and those are really important too, not just your business continuity in normal cases, but in that extraordinary case where we do have to lock down the building. So we're going to go through today how to prepare for the unexpected, and that's something that you need to think, this is why I need a plan, to prepare for the unexpected. The other reason that you need a plan is that real business thing that actually CQC needs to see your plan, and they need to see that it's updated and in a good position. So once again, thinking ahead and thinking, if I get this plan done and correctly now, then I don't have to worry quite so much when CQC come in and ask to see it, because you know what, it's already done for me. So that's what you need to be thinking about today. Many of you will have a plan, and that plan might be absolutely fine. But what we do also need to think about is if there's any new rules that have come in that perhaps you don't know about, perhaps things that you may not have added into your plan because you've updated the basics all the time, but you haven't actually added in the new rules. So that's what we're going to make sure today, that you have everything in place. And when we look at the wording that needs to be in our plan, the correct wording has all been checked by the emergency response team in in the ICB in Lancashire for my plan. So therefore we know it's working and it's correct. And because that's been looked at and we know that's working and correct, you can simply copy and paste that particular wording if you're missing things into your own plan, or you can start again and use my template, whatever works for you, to help make things easier for you and to save you a bit of time. What you're looking at the moment is a burning building. I'm sure you realise that. And why on earth am I showing you some scrubby old building that's burning? Well, actually, because this is a time when I really needed to use my business continuity. To talk you through the scenario, I'd been in post just a couple of weeks in a new practice. This was back in 2017. And the building that you can see in the back of the picture, the sort of light green building, that was the practice surgery. The building on fire next to it was a building that had been derelict for quite some years. It was an added complication because the partners of my surgery actually owned this building, and they were planning some building regs to happen there. They were hoping to increase the size of their surgery using the space that this building was on. But while that had been going through, the building had sat there, and unfortunately it had been broken into several times and was on fire. I received a call at around 6 o'clock in the morning from my operations manager telling me to switch on the local news because you could see the building on fire, and asking what she should do. So at that point, luckily, I had my business continuity that had been written up by my predecessor, and I'd just been in the process of updating and changing, in my bag. So I grabbed that business continuity, made my way to the site, and we started to work through relocation of our team, our communications, who we needed to contact, how to get hold of our patients, what to do as we went through the morning. So by the time the surgery was due to open at 8 o'clock in the morning, we had successfully contacted everyone. We'd relocated our teams, we'd contacted our insurance company, the council, who were putting safety stuff around that building by that stage. The fire brigade was already there, and we were making sure that everything was in place so that we could carry on and work forward, and that our patients would have the least disruption. We also had a pharmacy in the building, and that needed a relocation as well. And that was another piece of work to get organised, get hold of the main pharmacist, and get him working on the relocation of the pharmacy building. All of that happening was made so much easier by having a really good, solid business continuity plan. Otherwise, I'd have been starting again, trying to figure out what to do. So really, as I've just explained there, it's all about hoping for the best, but preparing for the worst. You may have had other scenarios. It doesn't always have to be a fire, such as the recent riots that happened in parts of the country where they've been outside asylum seeker hotels. A plan of readiness or business continuity can help you work through those areas. And also there have been, as you're aware, various terrorist attacks or threats of terrorism, which could have meant that you needed to lock down your building. And therefore, we need to go through what to do in those scenarios as well, to ensure that you are ready and okay if you need to lock down a building. But let's start with CQC, something that's close to all of our hearts and quite a concern for many of us. The CQC documentation requires that you have a business continuity plan. It's part of the CQC safe domain, and it will need to be a plan that is up to date and ready. If we have a quick look at Nigel's Mythbusters, something that any of you have dealt with CQC may be aware that Nigel's Mythbusters will let you know what you should be doing for for CQC, and making sure that everything is in place and ready for you, but not to do things and not to panic about things that perhaps don't need to be in place and are just a myth. What it does say that for your business continuity in Nigel's Mythbusters is when you are planning your business continuity, practice may find it useful to collaborate with other users of their premises or with neighbouring practices. This is to see if you can potentially use other parts of the building or other places when there is a disruption to your service. But also with other people in the building, this is useful that you're all on the same plans when it comes to something like a dynamic lockdown, and you need to be aware of that. The need to have showing in your business continuity any arrangements to show what you would do for short, medium or long-term impact on the running of the practice. So different scenarios, how long that would affect things, because something that may only affect it for a day is not as much of a problem as something that may affect it for a week, a month, or even if your surgery completely burnt down, you could be looking at 12 months. You need to have scenarios that go through what you would do with significant numbers of staff who couldn't come into work. If IT systems were disrupted significantly, not just the normal EMIS has gone down for a little bit, but significantly. If you couldn't use your premises for a period of time. One that's maybe slightly out of date is if your paper records were destroyed or damaged beyond use. But do think about when those paper records first arrive at the surgery, from some places that haven't been digitalised. Are you making sure they're scanned on as quickly as possible, even if you haven't got time to summarise them straight away, to make sure that there is an electronic copy of all of that stuff, because in fire or severe flood, that information would all be gone. But if it's held electronically and you can at least get things scanned into patients' notes, then that should form part of your business continuity, that you are saving those things. And also consideration if a supplier was unable to deliver essential goods or services. That's often the case if you have a dispensing practice. If various drugs can't come in, you need to have a backup plan, basically, of what you're going to do and how you may reach out to local pharmacies, etc. A robust plan should name a person who is responsible for delivering business continuity. In most practices, it will be the practice manager, but some of you may have a lead emergency response person, which is great if you do. One less job for the manager. It should reflect local risk registers and NHS England's core standards for emergency preparedness, resilience and response. So these are the people who have checked my plan that sit under that NHS England core standards for emergency preparedness, resilience and response. But it is the Lancashire ICB representative of that checked on my plan and was happy with it. So that should mean that you can feel reassured that everything is in there that you need, including the exact wording that they have asked to be placed in. Concerning terrorism, there is some proper wording that they need in there, and that's all in there for you. There should be a maximum disruption time for any functions, and describe how key functions will be restored within that time, and identify key materials, external services or staff that you need to maintain patient care when a problem is happening. So CQC, for their key lines of inquiry, will look at how well a practice can anticipate and plan for a potential risk to the service. And during an inspection, they'll look at what arrangements are in place to respond to emergencies or major incidents that might happen. So when you have your plan, a template plan, as I mentioned before, will be made available for you, and you can work through that plan to see if you've got everything in your current plan, or just simply start again with the new template. You will have to complete bits that are very specific to your surgery. I can't do that for you. So there will still be some work to do, but a lot of the hard work's been done for you. When we do start working through that, and one bit that you will have to decide very specifically for your surgery is working out your risk identifications and your assessment of that risk. And those are all done in medium risk, low risk or high risk, and you need to work through, and this can differ. So although there will be some examples in the template of what perhaps you could put in there, it is going to differ surgery to surgery. To give you a for instance of what might differ in those cases, if perhaps it was a situation where you had a loss of a building, that may be very different for someone that has 6 or 7 branches compared to someone that only has 1 building. So you need to think outside the box a little bit and think, what would it be like for my surgery if there was a problem? And when we think about that risk identification, we need to have a risk assessment, basically, for our loss of computer systems, a loss of key personnel, and don't just think about the clinical staff. Loss of the manager is probably one of the worst ones, because you've probably got several doctors in your practice, but probably only one practice manager. So loss of key personnel, clinical risks such as infection or pandemics and how that can affect everyone. I think those of you that work through COVID have probably got a separate pandemic plan that you can sit alongside your business continuity from the COVID days, where we had lots of risk assessments done and lots of planning. We also need to think about loss of premises and what we would do in those scenarios. So this is the time when normally I would ask you, when do you think we may need to move premises? Some of the answers that I've received have been things like fire, thinking back to that picture. Also, things like a flood. If you have a really bad flood, then you might have to leave the premises. We have to think about threats outside. So if there was perhaps a planned not riot, but a planned get together that could turn into a riot, we need to be aware of that, and maybe you'd need to move premises just for the day. Also, loss of water. You cannot have a business open if there is no water to flush toilets or wash hands. So that's another scenario where potentially you would have to leave your premises. All of these are risks that we need to identify and work out what to do. But when we're relocating, many people tell me they have a relocation plan. It's great, it's in place. But when did you last discuss it with those people? If you've got in your plan that it's a village hall and you haven't spoken to them for 5 or 6 years, is the village hall even still operable? Has it got the same manager in place? Do you need to have those discussions? If it's agreements with your PCN surgeries, just make sure that everyone's still on the same page with that, and that's still working forward. Can you work from home? And if so, are your doctors regularly bringing in their laptops and plugging them in on the system? Do they know how to work on them? What you really don't want is to spend hours going over basic IT because they haven't prepared in advance. You're preparing your business continuity. They need to prepare their equipment and make sure it's up to date, not dusty and under the bed somewhere. If you have a dispensary or a pharmacy in the building, there's lots of separate rules to follow. So please make sure you speak to your meds optimization team, which can help you work through any particular rules for that. And you need to think about, if you're on leave, sat on a beach somewhere, and this happens, you don't want your assistant manager calling you, asking you what to do. What you really want is for them to be able to grab that plan and know exactly where they're supposed to relocate or how to work through any emergency, because they can follow a basic plan. So make sure you have that discussion with senior members of your team, which will also include your partners. You do need to make sure that you have ways of contacting your team. Now, when this happened to me back in 2017, that was before all the WhatsApp groups were about. And hopefully, if you have WhatsApp groups that are formal ones for your surgery, you can put out some comms on there to tell people not to come into that building, where to go instead, or any particular plans and things that they may need to know ahead of time. That might be something as simple as all of the heating's gone off, and therefore you need to come in wearing a thick coat. Anything simple like that you can add on a WhatsApp group. But sometimes WhatsApp has been known to go down, or if there are massive data problems going on and all of the comms have gone down, all of your IT's down, then you may need to have another plan, and that should be that you have a list of all of the people who work at your surgery, and it should be up to date with their mobile numbers. You'll need to divide that list up, and when we go through later, there is a plan on how to divide that list up, and that's so that one person can't ring everyone, depending on the size of the surgery. If you've got 50 or 60 staff, that can take a long time phoning people. But if you can simply get that list divided up between a few people, then it will make it a lot easier, and you can relay those conversations working through. You will find as well, CQC have a little look at this list. There have been a couple of practices in the last 12 months as CQC are back out visiting that have actually still got the previous practice manager written in the business continuity, or partners who have retired or left. This really needs to be kept up to date. You may need it in an emergency, but also because if CQC find that that is wrong, you will fail that part of your CQC assessment. So it's really important things are kept up to date and correct. There is also a little plan that's held in there for you, which is an Excel spreadsheet. And on that, that's an equipment list. And the reason we have an equipment list, it's divided up with your laptops and your desktops, printers, etc. It's an ICB requirement that for their insurance purposes, if anything goes horribly wrong, you have this list. Imagine if there is a fire or something really dramatic that you can't get back into your building, like a severe flood. You won't be able to go in then and start looking at the what laptops you have in there, what computers, what number is written on those computers. You will need all that information where you can get to that electronically. So make sure that if you haven't got one of these plans in place, that you get one sorted out. And again, if there's any updates, anyone is changing your computers because something's out of date, make sure everything's updated on that list to make sure all the tag numbers are correct and up to date. It's your responsibility, not the ICB's, to have that in place. Most of you all know how to use the EMIS business continuity mode for your appointments and to keep your EMIS business continuity working. If you don't know, have a little practice when everything is working fine, because when everything isn't working fine, that's not necessarily the time that you want to feel under that pressure to try and get EMIS business continuity working. It's really worth having a look at this. There is a lot of help out there from Accurex or DocMan and all the other little bits of pieces that we use in general practice regularly. And if you can work through that, you don't have to do that yourself. If you have an IT lead, it's a good plan for them to do, but make sure more than one person knows how to use that EMIS business continuity for your appointments. And then the next thing we have to think about is electric or gas emergencies. So electrical emergencies are often things like loss of fridges, loss of telephones, loss of computers. Do we know what to do if that happens? If everything goes down, are we ready to have all our vaccines moved to somewhere else? Do we know where that might be? Have we got an agreement with a local pharmacy or another local practice? If these things happen, it may often be that it's just when you've had all your flu vaccines delivered and you really want to make sure that you keep all those vaccines. It's very important. There's lots of rules that you have to follow if things go wrong. But if you can have a plan in place to move everything in an emergency, that will make a real difference. We also have to think about, with gas, a danger to life under gas explosions. If I take you all the way back to that fire that we talked about at the beginning, in the aftermath of that, there were several gas explosions. So we have another thing to worry about. So if that is the case, you need to make sure that you are aware of all the phone numbers that you need to be contacting, and that should be in your business continuity. And one of those numbers will be the main emergency gas board. Now, obviously, in different scenarios, you'll be using different gas providers, but your emergency number will basically be the same people, and they can switch off your gas remotely to make sure that if anything explodes, you haven't got all that gas whooshing through that makes things worse, because fire will often cause explosions. So you need to have a plan in place for that. Another thing you have to have planned for in your business continuity is something that people often forget, and that is death of a staff member. And there is a piece in the template that will explain what you need to do in the case of a death of a staff member. But what we need to think about is, who do we need to inform, and what do you need to check, and what do you need to destroy? So if we think about that, the biggest thing that we need to plan for is, if it's a partner, because at that place, although not in a rush for your business continuity, but in long-term planning, we need to make sure that contracts are reorganized without that person. You need to make sure your mortgages and your or any bank loans on the building are sorted out, or rent, that person's not attached to them. You may need to form the GMC. You do need to inform CQC and the ICB to make sure that everyone is aware if you have a death of a partner that happens. But more importantly, death of any staff member, you need to make sure your staff are informed, and making sure that they're informed in a good, positive manner, in as far as this can be positive, and that's not on a WhatsApp group. Let's have a think about how we could inform people. Well, remember we talked about that cascade of communications plan that we could have in place, where maybe a partner or another senior manager calls certain people. You set up a call relay for that to make sure everything's in place. And we need to make sure that we have those plans in place for death of a staff member, and that it is mentioned within our business continuity planning. And what we would do if that person has gone, we have to have a backup plan. And that way you should have your protocols and procedures written out for everything that you need to do. They don't need to be in your business continuity, but you need to know that they are in place in case somebody has to take over somebody else's job when something has gone horribly wrong. I'm going to take you back to the beginning. And do you remember we mentioned the NHS England's guidance for NHS England Emergency Preparedness, Resilience and Response Team? Wow, that's quite a mouthful. They need some particular wording on chemical incidents, where you plan to manage for self-presenting patients in healthcare settings when a chemical incident has happened. And there needs to be a plan in place for responding to any of those hazards, and that the principals in this document will work through that. What I've done is taken the exact wording that we had to have in our plan, and I've copied it and pasted it into the template to make sure that I've got their wording. That wording should help you work through what you need to do in a chemical incident. And therefore, if you haven't got that in your plan, please feel free to just copy and paste that part of the template that is given to you out of my plan and into your own, if you're not using the whole template. Another thing that I found many people don't have in their plan is the new laws that have come in. And those new laws at the moment are Martin's Law. It's actually officially called the Protection of Premises Act. But for those of you in Manchester will remember the Manchester arena problems that happened back in 2017. And then all the way through to April 25, we've finally been given the Protection of Premises Act, but that's commonly known as Martin's Law. And this is to protect the security and preparedness for terrorism that may happen. Anything that falls under the scope of that means it is at least one building. So that would be your surgery. And the potential that 200 people could be in that building at any one time. Well, have a little think about that. What happens when you're on a big Saturday flu clinic? Is it possible that that many people could turn up having arrived early and queued up to being in the building? Or what if you're in a shared building, in which case there may not be 200 people in your part of the building, but there might be across the building. Think about those flu clinics, social events, large training sessions, anything like that. If there is any possibility, even occasionally, that many people would arrive within your building, it should be mentioned in your business continuity. So what I've done is I've done the wording for now that we can put in about Martin's Law, but we have 24 months to implement changes, and slowly guidance is being released. So we should get final guidance will have come through sometime before April 2027, a little bit ahead of now. So we may have to keep updating that guidance and the wording that we use. So do look out for any training or any information that comes out on Martin's Law that you may need to amend what I have worked out for you to currently pop into your business continuity. When we're thinking about Martin's Law, we need to have a building responsible person, and that is one who has control of the premises. It's one per building, not one per practice or anything like that if you're in a shared building. So you need to work with the other people within your building to make sure you know who that building responsible person is. And you have to have in place public protection procedures, which include your dynamic lockdown. And we are talking about that today. And again, we have a template for dynamic lockdown. If you are expecting over 200 people, you should be informing the Security Industry Authority, and they can ensure that they have plans in place to get to you in an emergency. NHS England, as they still are currently called, have confirmed that NHS is included in Martin's Law, and that's why we'll be getting further information on this. But if for now you just want to copy and paste the part in business continuity template into your template, that means you are covered at the moment as things stand. We need to think about riots, as riots have been happening across the country. At the moment, quite a few under different political issues that are happening. Remember, in a riot, if there is a riot going on outside, you need to keep yourself safe. Use your dynamic lockdown procedures, which we are going to go through in a few more slides. Lock up the surgery if needed. Check on your staff who might be on visits. Lock your doors and let patients in one at a time, if safe to do so. And make sure your comms is updated. That's probably the most important part of this, that people are aware what's happening. But we'll go into that in more detail. This is just a copy of that communications plan that I mentioned earlier, to make sure that you have a comms plan for how to cascade and how to work through for everyone to be aware of anything that you need to communicate to them that is either inappropriate for WhatsApp or WhatsApp is not available at the time. I would really advise in these communication plans, you don't put people's names, but you actually put in there people's job roles. Then it will be one less thing to change if anybody does actually leave, retire, move on. That way, that particular job role will hopefully be staying, maybe a different person doing it, so that communications plan won't need as much adjustment. And I have been asked to briefly mention PCNs, how you should really have your own business continuity plan if you have your own premises, as some PCNs are fortunate enough to do. But if you actually work within the surgeries and everyone moves around the surgeries, it's quite nice to have a PCN plan that has each of your PCN surgeries plans embedded into them as an overarching plan. And that's just really that absolutely gold standard, so that perhaps if the practice manager was away on leave, the PCN manager could have copies of those plans and assist as required. But if you have your own premises, you definitely need to have your own business continuity plan. So really what we're talking about is a high quality continuity plan, which needs to be updated very regularly. Every time there is a change of staff, it will need to be updated. Every time you have a different change in providers. So think about if your ICB lead for meds management changes, that should be in your plan and you would need to put a new name in there. Also think about when CCGs became ICBs. Did you actually update the wording in your plan, or does it still say CCGs? Believe it or not, CQC have been out and found a plan that mentioned PCTs. For those of you that are a little younger in here or haven't been in the job quite as long, PCTs disappeared back around 2008. That tells me nobody was reading that business continuity every time they did the update. And CQC most certainly picked up on that. So do make sure that you are updating things properly, and every time a staff member joins or leaves, that their details are either removed or added as appropriate to keep everything properly up to date in your business continuity. Need to also ensure that you have an emergency box. This is a box that's a grab and go, really, at that emergency kit if something goes horribly wrong that you can grab and take with you. Normally kept behind your reception desk, your check-in desk, basically. So all of your staff need to be aware of it, and they need to understand if they are working in that position and you evacuate your building, they should be grabbing and going with that. It needs to contain as a minimum a first aid kit, a high-vis vest, a torch, a copy of your business continuity. That's probably the paper copy that you'll have to have, and you'll need to keep it updated. They do say a water bottle. I think that depends on your area of your surgery. If you're surrounded with shops, maybe not so much that you'll need to have that, and snacks and things like that. But it is possible, and it may be useful to have a few bits and pieces that you can potentially use in those cases of emergency. It's also really highly regarded by CQC if you have an emergency box in place. Now, to go on a bit further, we're going to now start talking briefly about the dynamic lockdown planning. If you're planning a dynamic lockdown, your very, very first thing to do is just to make sure that you actually have a dynamic lockdown policy. This can't just be off the shelf. It must reflect the way you work within your own business or practice. So you need to have a think about it, read through it. We are providing you with a dynamic lockdown policy, but again, you will need to change that. Think about if you have a branch surgery. That may be having to be covered by dynamic lockdown, but it might be completely different due to the area it's in or the size of the surgery. So make sure that you have a plan in place for that. You need to have a lead person for dynamic lockdown and a deputy. So again, that might be the same as your business continuity. It may be you and your assistant manager. It may be one of the partners. If you have a branch surgery, you should have a lead at that branch, someone who is regularly stationed at that branch. You may have a branch manager, or in smaller cases, it might be that you've got a member of staff that regularly works out of there. But they need to be aware. You need to have plans in place for everybody that may have to lock down a building. Whoever you've chosen as your leads, work through the plan together and think about different entry points to the building and different scenarios that could happen where you may need to lock down a building. And do have considerations if you're in a shared building. Who's going to lead then? Are there going to be arguments between different surgeries within the building and different, maybe you have a pharmacy in there, etc.? Or do you need to really have a think about that and pick a designated lead across all of you? How will you communicate with each other if you're not working for the same company, and have a plan in place for that? Share the plan with your team and really do talk and discuss the need for having dynamic lockdown drills. We have actually made a separate video on how a manager can prepare a dynamic lockdown drill. So hopefully when you've watched this, you may decide to have a look at that video to plan and prepare your lockdown drill yourself. And that comes with its own host of paperwork to help you through planning those drills and maybe get you that one step ahead. If anything goes horribly wrong, you've got that plan in place. And again, you will feel more prepared if you have drills. Just think about the school children in the USA who have, sadly, they have shooter drills. What would happen if somebody comes and starts shooting within the schools, and what they do in those scenarios? And young children practice that so that they are prepared. Well, we need to practice that with our staff. It's different to a fire drill. It's very different. So we need to make sure everyone's not rushing out. They're actually staying in. We need to lock down the building. So we've made that separate video to help you through those scenarios and make things a little bit easier for you. When you first do it, unlike the fire drill, start with a plan drill. Tell everyone we're going to do a drill today. Preferably pick a PLT afternoon so that you haven't got to deal with patients the first time round. Give everyone jobs to do, talk to them ahead, and then do this plan drill to see how it goes, how things, don't try and catch people out. Let's just work through all of the different things, as will be described in the separate video. And do the same at the branch surgery. And then when you've had those drills, have a look round afterwards. What was missed? How could you have safely let patients out, because patients won't be there? If you've got a really fun team that want to really take part, you may decide to have pretend patients, or even a pretend person outside the building who is the intruder, the person you want to lock out. And don't just think about terrorism here. This could be a patient that's rung and said they're coming down with a weapon to hurt people that you may have to lock down. It could be a terrorist attack that's happening outside. It could be a riot where you feel it might overspill into the surgery and cause staff and patients harm. Think about when you've done your plan drill, what would you do for staff who are out of the building? So this might be somebody on a visit, or somebody that's due to not start until the afternoon. How would you let them know? Make a really good communications plan so you know how to work through that dynamic lockdown, whatever happens. Think about, do you need any permanent supplies in the building for long lockdown periods? Do you need to have a supply of emergency cereal bars or some kind of food source that you can make for people, so that if in a case of a severe emergency, you've got stuff in there? You should all have medical supplies. It's a doctor's surgery, so at least we don't need to think about that. Everything that you found went wrong in your planned scenario, get that all written down. Make sure that you put plans in place to get things right, whether that's more training with your staff, whether that's more just generalized meetings, written down as a significant event, and then organize an unplanned drill, one that staff aren't aware of ahead of time, and see how that one goes. And keep doing it until you feel really confident, because unfortunately it's becoming more and more of an unsafe place, and therefore we need to work through things. So to recap, plan your lockdown drills, organise a drill, involve your team. Consider what you do after the event. And then also, do you have resilient plans in place for your team resilience? Are they going to be very stressed? Having a look at those stress levels of the team. Nobody knows how they're going to feel, but you should have plans in the aftermath of an event for calming your team down, helping them through this, and organising some help and assistance for them. That might be sometimes just having the provision of who they could contact to get that extra help. We do provide you with a lovely big list of help for staff and what to do in those scenarios. Do start to make plan drills a part of your health and safety planning going forward, just like you do your fire drills, to make sure everyone feels confident and they know what to do. Because the more you go over things, the better the staff will be at reacting and knowing what to do, and they'll feel more confident. So as mentioned, we'll be organising a short video for how to organise a dynamic lockdown drill for your team. And we'll also be organising resilience training videos for your team. And that's to help them not just in these awful cases of dynamic lockdown or terrorism, but your general resilience in how your team can feel more resilient on a day-to-day basis, just with the normal struggles and strains of coming to work in general practice. But we do go over with them within that resilience training video some extra bits. And those extra bits are about how important it is to take part in dynamic lockdown planning and their fire drills and all of their health and safety that you managers really are putting in place for them to help them to understand why we do that. When we organise this resilience training video for your team, it's something that you can just pick up with various handouts that come with it. Me, will talk your team through everything they need to do to keep themselves more resilient. But what would be good for you as managers is to organise this maybe on a PLT afternoon where you can put it on a big video screen for them, and then perhaps share that time and experience with them to work through and make sure that your team have the best opportunity to remain resilient. So to recap totally back to that business continuity plan, you need to make your plan from the provided template or use your own template and add in the bits that you don't happen to have. Remember to update it when new staff join or you change any suppliers or there are changes at the ICB. And remember that this plan was made, or this video was made in 2025 on providing for the 2025-26 tax year and the plans that have been in place for that particular financial year. Obviously, things change all the time and new laws come into play. For instance, things like when Martin's Law came into play, you will need to keep your plan updated on those new rules unless a new particular plan has been brought into place for you. So I really hope today's training has just given you either more confidence that you've actually got everything right and in place, giving you some ideas on dynamic lockdown and what you need to do to help get you through those difficulties, because obviously these can be really challenging times, and that should help get all of that stuff in place for you so you feel more confident to deal with any emergency. So thank you very much for your time today, and I'm really hoping that was useful for you. Take care, and let's hope that all these things will be lovely in place, great for CQC to look at. But I hope for you that you don't actually have to use those in a real emergency, but you're planned and ready for it if that comes along. Thank you so much, and goodbye.